All right. So welcome everyone. We've got other participants as well joining in. So I'm just trying to accommodate everyone. All right. Just wanted to check with everyone if you're able to see my screen and is it a PowerPoint presentation? Yep. Is it where I hover my mouse? Yes? No? You can't see?
No.
All
Oh,
right.
yes, we can see. Yeah.
You can see it now. Okay, so that's not
Yeah.
the right one then. Let me just do that again. Okay, I think that's the right one now. All right. Yeah, Karen can see my screen. Thank you very much. So let me just check. Maria Corazon, welcome to the information session. Just wanted to clarify, just feedback if you're able to hear me. Just a yes or a no or a chat. That would be good. Thank you.
Yes, Miss Carissa, I can hear you.
Perfect. Thank you. Thanks a lot. Maria?
Yes, Miss Carissa.
Okay. And then Anshu is here as well. Anshu, are you able to hear? Just a yes or a no.
Yes.
Perfect. Thank you very much. All right. So as I said earlier, I am recording this information session for quality purposes, quality improvement purposes, sorry, and also for our reference in the future. Should we need this, this will be uploaded in our YouTube channel where we put all our demo classes. So you can revisit this. We know it normally takes about 2 to 3 days before it gets uploaded. So just keep checking and keep yourself updated. So good morning, everyone. My name is Carissa. I'm the nurse educator for Nursing Education and Training Australia. I'm also the nurse manager for Neta. So welcome. To those who don't know me, just a very quick introduction and very quick briefing. So I am an overseas registered nurse myself. So I did my training back in the Philippines. That's where I was born, and that's where my parents raised me up to my 5th year of experience in the Philippines. So up to my 25th year. Then I came to Australia and did the bridging course. I became a registered nurse. I worked in surgical and palliative oncology, surgical specifically in vascular, urology, oncology, obstetrician and obstetrics and gynecology, and also neurosurgery. Then I became an educator for urology and also for neurosurgery, and then became an educator for the bridging course. And that's where I found my passion to teach overseas registered nurses. I've been in the same shoes as where you are at. And that's where I really found that it's a very complex process to be able to come to Australia and practice as a registered nurse. And that is where the passion came from. So I then became a nurse educator for the new graduate nurses for Southwestern Sydney Local Health District, which is unfortunately the main, not the main hub, but the main place where the coronavirus is at the moment, and also became the nurse educator for the new graduate nurses for Murrumbidgee Local Health District. And now I am full-time with Neta because this is where I love to work, and it doesn't feel like work for me because this is what I love to do every day. So yeah, so that's me, and I also would like to acknowledge, and this should have been the beginning, and this is the acknowledgement to country where we always acknowledge our Aboriginals who we know that are the traditional owners of our land. And also we'd like to acknowledge their elders, past, present, and emerging. So welcome to our demo class. So this demo class is all about laboratory values, but also I'd like to quickly share with you the pathway to become a registered nurse in Australia. And this is very quick because this is a tradition of Neta that we always talk about registration in Australia prior to our demo class. So just fast facts and very quick one. Neta is the leading provider of outcome-based assessment preparation course, and we are proud to say that we are very student-centered, people-focused, and outcome-oriented. So when we say student-centered, our student support is there with Karen, the OBA course coordinator and also our education supervisor. And they're there on top of everything just to make sure that our students are well guided. We are very people focused, and you probably can see that with the social media pages, how we deliver our courses and how we interact with others. We establish very good professional relationships also with our students, because we know that as much as we are able to help all of you, you will also be able to give back to not just to us, but to the Australian community when you become registered nurses. And nursing is a very small world. We are going to meet again when you become registered nurses. And we're very outcome oriented. We really want results. And you know, no matter what we do, we do, we always go back to our mission, and that is for everybody who enrolls with us to pass and become successful in your exams. We have ongoing numbers of passers for both NCLEX and OSCE, and I think it's going to be countless now. So, so that's why I've put here ongoing numbers of passers. But looking into the results, because we're outcome focused, we have already 11 registered nurses in the whole OBA program. We want you to be part of this success. We cannot fit everything here, but if you want to see the life of our students and life of Neta, please join us through our social media pages, and you can see all of this and a lot more. We want you to be in this celebration as well. So that's the reason, as we said, we're people focused and also we're outcome oriented. We really need you to pass your test, and that's a need. That's not a want, it's a need. And I know that also that is also a need for you guys. Here are our 11. I managed to fit everybody. These are our 11 registered nurses already. And why I am showing this is because I really want you to be inspired that if 11 people have done it, then you can also do it. This is how you are going to be in the APRA register. Once you finish your OSCE, so I know a lot of you are also doing NCLEX and also OSCE. Once you finish, when you go to apra.gov.au, you go to search the register. Your name will appear there. No photos. That photo is just for social media. But your name will appear in the register. And anybody in the world, you can boast that to all your relatives and friends that you're actually in the APRA register. And this is how it's going to be. If you click on the view details, you can also see all the details of your registration. So if you want to search me, my name is quite long, but you can type Subedi and Carissa. You can see me there as well. So as your other educators, all of the NETA's educators are registered nurses in Australia. And if you want to know the principal place of practice, if you want to know when are they registered, so you can count how many years of experience we have, you can also do that. APRA is very transparent when it comes to your registration. So we as educators and NETA are also very transparent about that. So yeah, this is you. How good is that? How exciting. So this is where we also establish psychological safety in our classes. The traditional way of class is very one way, where the teacher is the one who talks, the student just listens and take down notes and memorize and then answer the exam. In the way we deliver our classes, it is very interactive. We do have current students with us here today, and I think they can vouch for that, because at least everybody, all of them at least, have spoken to in class at least once, but that's only at least once. It would be more than that. This is where we deliver OSCE, and I would say that this is across Australia. So the first photo here on the upper left is taken in Brisbane. Then we have in Sydney. Then the next one to the right, upper right, is in Adelaide. Then we've got Sydney, Adelaide, Sydney again, and then Melbourne. So we make things interactive and fun because we know that when you are safe and when you feel safe, you will be learning a lot. So that's where we have our psychological safety. So that's our vision and our mission, and that's what I was telling a while ago. But what I really want to emphasize here would be our values. So all of the educators and the students as well would show that this is what the values of Neta, and we are practicing this. We value that everyone is knowledgeable. We know that everybody who is attending right now is a registered nurse. Whether you're a registered nurse back in your home country or somewhere else, the only difference is you are not yet a registered nurse in Australia. And I like the word yet there because you will get there. We will be sharing our knowledge in the classes. You can share your experience, you can share what you know, because we know that you already know these things. The only difference here is that we will be guiding you according to the Australian standards of practice. We value support, and you can see that you're really well supported, and we always follow up our students just to make sure that they are actually on the right track. We respect everyone. We know that we are coming from different backgrounds. We have psychological safety put in place because we want everybody to feel welcomed and also feel respected. Teamwork here is for everybody, not just for the team in Neta, but also for everyone in the class. If there are things that we need to do together to find out the answer together, we do that. And of course, transparency. Whatever you see from us is what you get from us. Whatever I say now is true. And I know that there are a lot out there of information. We in NETA, the only thing I can assure you is that we are providing the most accurate and the most transparent information. Let's begin. Laboratory values. I just wanted to ask from the group, how do you find laboratory values? What are your thoughts about it? Maybe we'll start with, and guys, you're all on mute, by the way. So if you want to talk, don't forget to unmute yourselves. Okay, laboratory values. What is it that you, just one word, first thing that comes to your mind? Aside from the word difficult to memorize. K Kong, they are so many. Yes, definitely. There are so many. How can we put that all in our mind that when we go to NCLEX, our mind is actually light and not heavy because we are scared that we might not be able to remember the laboratory values. Thank you. Who else? Anyone else would like to share? Vishwa, you have unmuted your microphone. Would you like to share your thoughts about laboratory values? I can see your reaction. I didn't mute.
No, for me, sometimes it's confusing because, sometimes they put that like 2 unit.
Yes.
So, yeah.
And I'd like to address, yes.
And sometimes they put the like 1 unit correct. And in the comma, there is the like wrong unit. So sometimes it's confusing to, yeah.
That might just be a clerical error. The reason why I'm saying that is because in NCLEX, you will get 2 values. So it is good that you will memorize 1 unit of measurement, but also become familiar with the other one. So that is important. But yes, the word confusing because there are so many, and I think the reason there is because it's numbers. You can always mix up numbers except your telephone number, where you have the muscular memory to say that this is my phone number. But you can actually interchange them because of the numbers. So yes, confusing. There's so many. What else? Anyone would like to share in the group? All right, I actually waited for 8 seconds, and I think whoever has attended my classes or the information session, I always wait for 8 seconds before anyone will say anything. But yes, definitely those thoughts of confusing and so many are really valuable. NCLEX will actually, the only goal of NCLEX is it doesn't want to make you confused, so you will fail the test. That is not the NCLEX goal. The NCLEX goal is it will make that question as simple as possible for you to be able to know and critically think. It is all about critical thinking when it comes to an NCLEX question. So let's go to the next slide. So NCLEX can ask you any value. These are fast facts, any value. And what does it mean is anything when it comes to laboratory values. It could be in any concept. It could be, say, it could be electrolytes, or it could be about, say, troponin levels, or it could be about liver functions, or it could be about renal function. So it's anything, and it's in any test format. So when we say any test format, it could be a multiple choice, which is easy because we can do the process of elimination. It could be fill in the blanks, which doesn't happen most of the time. It could be the graphic information. It could be exhibit as well, where you have to click on the exhibit button. And if you have attended our classes, one of our Wednesday classes actually talks about the test taking strategies when it comes to exhibits. So it could be an exhibit. There is also SATA question, or SATA, or select all that apply question. And it could just go around there. On top of that, it can also be according to any client need. So it could be safe and effective care management. It could be about physiological integrity. It could be psychological integrity. It could be health promotion as well. So you have all these 4 client needs, and it could be anything around that. And we will be doing a sample test question later on for NCLEX and also for OSCE later on. You can be presented with any laboratory values in OSCE. So what does that mean is, if you're looking into OSCE, because I know that a lot of you here are looking into NCLEX plus OSCE, or just NCLEX or only OSCE, but if you look into your OSCE scenarios, you'll be presented with any laboratory values. This time, it is going to be you as a registered nurse who will need to make your decisions according to the laboratory values presented to you. Okay, so looking into that, what do you do then? And what is essential? Because there are so many distractors, and I have, if you join in our class, I have always been telling students that there are so many distractors. But if it's only, like, say, multiple choice question, there's only one answer. So we only base the things that are really essential. So what do you do then as a test taker, as a candidate? What are the things that you will do to be able to grasp the essential things when it comes to laboratory values? Any idea from the group? It's funny how I always count 8 seconds, but yes, that is the reason why we are here in NETA. If you have joined our classes, or you will be able to join our classes. This is how we approach our laboratory values when it comes to OSCE and NCLEX. So we do have application of laboratory values, which is already in our learners portal. And this is a very good discussion from Joanna on the on the theories of laboratory values, but also there is a discussion there from Lovely about some sample NCLEX questions and how are you going to address these laboratory values. We actually put that together with ethical and legal issues. But yes, I just wanted to highlight laboratory values in there. We also do this in our study tips to keep you motivated and the test anxiety management to keep you going. So here it is, that very colorful presentation. My son loves this because he said that it's very colorful. But yes, looking into that, the study tips there actually will help you remember these laboratory values. I'm not sure who have attended the study tips. If we have students here who have attended these study tips to keep you motivated, test anxiety management, to keep you going. But one thing here that we have put through is for you to actually develop a flashcard. So that flashcard actually would alert you each time you look at this potassium. If you look at that, you don't write the normal value of potassium in your flashcard. And what is trying to ask you is, what is the normal value of potassium? What will I do if my patient has low potassium? What will I do if my patient has high potassium? It actually allows you to think with just one word in your flashcard. Okay, I'm not sure if that's in my generation or if you're in the newer generation or older generation, but I use index card when I used to study back home. So I'm not sure if you're aware of an index card, but I use that and I just write big potassium, and then I recall everything that I know about potassium. Then we do have visual memory as well as part of the study tips there. Visual memory is, and I know that a lot of our students are doing this, is when you go to your student portal, and to those who are enrolled with us, you can actually see the students portal. Under your students portal, you've got your resources, and our very good marketing and course development worked together on this and has developed the must-knows. And in that must-knows, which I have already opened, that must-knows has two pages there that actually tells about laboratory values. And these are the normal values, and this is something that you can print or you can enlarge, and you can print just next to your bed or on, at the ceiling, so that by the time that you sleep, you can see sodium 135 to 145, potassium 3.5 to 5.5, calcium 2 to 2.6, or 2.1 to 2.6, or 2 to 2.5, sodium, potassium, whatever it is, BUN 10 to 20, whatever it is, you can see it in there. Okay, so before you sleep. So when you say your prayers at night, thank you, God, for such a beautiful day, read at least 5 of your laboratory values so that you'll be able to memorize them. And it is a visual representation. When you answer your NCLEX question, you will look at your ceiling and you can remember that your folate, for example, is 5 to 20. Okay, so that is another technique of memorizing that. In this must-knows as well, you can see a lot of other resources, but you can see here significant client history, whether or not there are different laboratory values involved. You can also see here the laboratory data for certain disease conditions. So say, for example, an allergy would actually tell you that there is an elevated IgE. Okay, so NCLEX will not only ask you about the values, NCLEX will also, Bharat, I can see you said, good idea, ma'am. Thank you, Bharat. And I hope India, actually, Bharat, I hope that you're safe there in India. So you can actually see here the laboratory data for certain disease conditions. You can see that in liver cirrhosis, there is an increased liver function laboratory values. You can see here in Lyme disease, there's also an elevated blood values in there. So this must knows is actually a wealth of information for all our students. And if you are not a student, it is very essential for you to actually have some techniques for you to be able to know, or some styles for you to be able to remember these laboratory values. All right. And the last one is that you can create a story out of them. And I will share you the stories of some laboratory values where I am able to memorize them because of the stories behind my head. So that will be in a different slide. Also in your OSCE, so if you're looking into OSCE, you can see that we incorporate laboratory values in different scenarios. I have just put in 2 of the scenarios, of the very many scenarios that we really go through OSCE. I have put these scenarios, and you can see here that they're all incorporated, even in your checklist, how you have the understanding of those laboratory values as well. You can see a standard observation chart, but you can also see here a part of it has some laboratory values involved, and we will be teaching that to you in OSCE. The observation chart, or what we call the vital signs chart, we call it in Australia observations chart, has a lot of significant information. It may look overwhelming for you, but when you enroll with us in OSCE, we will teach you how to look into these items and information. So you can see how we are integrating the laboratory values in both NCLEX and OSCE. All right, so I was telling you about my story. And I will share to you how I came up with my story. And this is just because it's a demo class, I can't tell you all of the laboratory values, but I would encourage you to make your own story. This, I think, by far the most effective way of memorizing laboratory values. And by saying that, if you have a very good visual memory, go for it. It's very good. But if you don't have a very good visual memory like me, because I'm an auditory person, what you can do is actually make a story out of it. Potassium, what's the normal level of potassium? Anyone?
3.5 to 5.5.
3.5 to 5.5. How did you remember that visual?
So I remember like sodium is 135 to 145. So just remove the 111 and just put the 3.5 and 4.5.
That's very good. And that is one example of your own story. With sodium, it's 135 to 145. With potassium, remove 1. Very good. Anyone else? How do you recall 3.5 to 5.5? I think when it comes to potassium, it is very common already. And why it is very common is because it is one of the high-risk medication. And that is the reason why we want our students to actually know what is the normal value of potassium, because NCLEX and OSCE can ask you so many questions around potassium. So a very good example is taking out the 1. So that's 130. What did you say? Taking out 1 of the sodium and deducting a little bit, 3.5 to 5.5. Yeah.
So we can remember 1 time 2 normal values.
Yes.
So, yeah.
That is a very good idea. In my own way, I always remember potassium. What fruit is high in potassium? I can lip read Marikar. Marikar just say banana. Is that correct, Marikar? Is that what you said?
Yeah, banana.
Ah, Maria.
Yes, Miss.
Yeah, Maria also said banana. Good. Banana. Banana in Australia per kilo costs about $3.50, and it would range up to five. Some books would say potassium is 3.5 to 5.5. Some books would say 3.5 to 5. Remember, NCLEX is not there to trick you. NCLEX will give you values that are really out of range. Either NCLEX will give you a potassium level of 2.5 or 2.8, or a potassium level of 6, 6.2, or 7. So looking into banana, it's 3.5 to 5.5. Karen has said melon. Yes, melon, oranges, potatoes, they are high in potassium. For me to be able to remember this, and you can have any story in your life. Maybe you're eating banana, it was 3:50 in the evening or 3:50 in the afternoon, and then you realize, okay, 3:50 in the afternoon is 2.5. Maybe you can say that, but in my own experience, every time I go to Woolworths or shop, I can see banana is actually about $3 and something to $5 and something, depending on what type of banana. I like how Vishwa is laughing there. You have to just create the story in your mind just to make sure that you can actually get that value. Calcium. What is the normal value of calcium?
9 to 10, 10.5.
So in your must knows, there's milligrams per deciliter, which is 9 to 10.5. In other books as well, it will give you the millimoles per liter, which is 2 or 2.1 to 2.5 to 2.6. And again, these values doesn't really matter whether you say, oh, one book says 2, the other book says 2.1. That is not a problem. NCLEX, again, will not ask you this small range. It will give you out of the range numbers. So how would you remember that? How can you remember it's 2 to 2.5 and 9 to 10 or 10.5? How did you remember that? Vishwa, how did you remember 9 to 10 or 10.5, you're saying? Rajani Bharat, there's a Galaxy A30. Manu, please feel free to participate if you have any ideas. We would love to listen as to how you memorize them. Yes, Vishwa.
I didn't make any story, but I just remember that number.
Yeah. And if you try to remember so many, it actually makes you feel that there's just too much. And sometimes when you get overwhelmed, you just don't worry about laboratory values. Don't worry, there's not much going to come out in the test. But if you look at our test questions later on, they actually cover the whole of the client needs. So it could be, they could come out in a client need of safety. They could come up in a client need of physiological integrity, psychosocial integrity, and they could also come out in health promotion or reduction of risk potential. So in that case, my idea, and this is my story, is when I go and buy the 2 liters of milk in Woolworths, because milk is high in potassium, it actually cost me $2 for the Woolworths brand. Okay, I'm not talking about dairy farmers, they're a bit expensive. So it's actually 2. So that's 2 millimoles per liter. And okay, I can extend up to 2.5. I can spend my money up to $2.5. And I also will remember that I actually take milk when I wake up in the morning about 9 to 10 a.m. So this is how I remember taking milk at 9 to 10 a.m. or maybe I get late, 10:50 because it's 10.5. That's actually when we take milk. And so that's how I remember calcium. BUN, Who has attended my class and who can share how I remember this BUN?
You are 10 people and was buying bun and was sharing the food. I mean the bun. So
Yes.
it's a normal 10 to 20. And you are
Perfect.
15 or 20. I can't remember exactly, but I can remember that one.
You can remember the
Little bit.
story, and you
Yeah.
told me that we are 10, and then we buy times
Yeah.
2, and it became 20. So the value there is
Yeah.
10 to 20,
Yeah.
isn't it?
Yeah.
So, and is that how you're trying to remember BUN now, Vishwa?
Yes. Yes.
Good.
Yeah.
Thank you for taking that story. At
Thank
least when
you
you
for
answer
that.
at least when you answer your NCLEX, you can remember me. But
Yeah.
BUN sounds like bun. And I'm not sure if you're familiar with the song Hot Cross Bun, Hot Cross Bun. um, I can I can see is that Bharat who's just like recalling that song. So that hot cross bun, which is BUN, actually costs $2. We are 10 in the family unit, not in the unit. Sorry, we are 10 in the family, and each time that we buy that hot cross bun, we buy 2 for each. So then we ended up having 20 hot cross buns, and that becomes 10 to 20. Some books would say it's 8 to 22, but then again, NCLEX will not give you very confusing numbers. It will give you out of the range numbers. CRP. What is the normal CRP level? CRP level is crap. CRP, crap. Only 10. 10 as the least number. 1 trillion as the maximum number. Crap, only 10. So CRP means it is less than 10. That is the normal value of a CRP. It's crap, okay? Because it's only less. CRP is crap. Urinalysis. What do you recall about a urinalysis? Anything positive in a urinalysis, when you do a dipstick, anything positive there is abnormal. Okay? And the only thing that you need to remember with urinalysis is actually the urine pH, because that is the only number that will come out in NCLEX. Others would be positive or negative, whether it's positive in leukocytes, that's something that you need to escalate. Whether that's positive in ketones, that's something that you need to escalate. Whether it's positive in RBCs, that's something that you need to escalate. So anything positive, you need to consult somebody, okay? As an entry level or as a new nurse, this is something that you need to take action when there is something positive in a urine. The pH level of urine, how much is it?
7.35 to.
So that is our blood pH level. The 7.35 to 7.45 is our blood pH level. We're talking about urine. So it ranges between 6 to 8, up to 7.5, but some book says up to 8. So between 6 to 8, that is still considered okay. While you go to your dipstick, it is only 6 that is acceptable in your dipstick. The others, it becomes a little bit more basic. So when it goes to 8, but in NCLEX books, up to 7.5 is accepted. NCLEX will not tell you very out of the range numbers again. So if you look at that Facebook post, that pH level I think was 7.3. So that is actually not out of the range. It was actually normal urine pH level. So if you look into that early in the morning, when you get up at 6 o'clock, or say about 7, or even up to 8, when you wake up in the morning, that's when you do a wee. That's when you pee, and that's your normal urine pH level. Okay, between 6 to 8. So making a story, and I think even if it's very long when you analyze, but you remember the story, I think that's a very easy way of memorizing it, isn't it? HbA1c. What is the normal HbA1c?
7.8.
Sorry, Sandesha, you were trying to say something?
5% to 7.8.
7%, did you say?
5 to 7.
5 to 7, all right. Books would say between 4 to 7, 4 to 6.5, and that is fine as well. So you can see the different variances here, but anything between 4 to 7 is an acceptable range and is in percentage, acceptable range of HbA1c. What does HbA1c checks for?
Blood sugar level of 3 months.
That's
3
actually
month blood sugar level.
Yes, it's actually the blood sugar level that is present in your heme, and because it's hemoglobin, right? So it's hemoglobin A1C. So that's actually in your hemoglobin that exists for 120 days, which is equivalent to 3 months. Your hemoglobin has the lifespan of 120 days. And that is the reason why we check HbA1c. And patients cannot cheat even if they fast before the blood test, because it's been there for 3 months already. So in that case, so if it is HbA1c already there for 3 months, for you to be able to remember, that's 3 plus the number 1 here, isn't it? You've got number 1 here. So 3 plus 1 is actually 4. So the normal value is 4, and always just remember 7. My son, and this is how I remember it, because my son had always have sugar rush. He's now 4 years old, always have sugar rush at 4, and I always will just remember that this is gonna go up to his 7, because they said that the easiest stage to look after children is 8. So maybe they don't have sugar rush anymore in that sense. So 4 to 7. Blood glucose. Again, it is very similar to your HbA1c, okay? Between 4 to 7, but sometimes we accept a range up to 8 for the blood glucose level. Okay, so it's very similar. Some books would give you 80 to 120. Some books would give you 70 to 110. Some books would give you, Maria just said 70 to 110, very good, or 80 to 120. So again, NCLEX will not give you 121 or 122. Okay, NCLEX will always give you 200. So that is very out of range. And I think in that Facebook page, again, in that post is, I think 200 something or maybe 200, but that's really out of the range. So memorizing it would be HbA1c is quite similar to your blood glucose level in millimoles per liter. What about your ALT, AST? How would you remember this? In most of the NCLEX questions that I have encountered, if it talks about liver function test, that is not normal. They always give over 100. Okay, always over 100, which means that your ALT or your AST, because it's for the liver, think about the age where the liver is good. In normal adults or normal circumstances, liver is good between 5-year-old to 50-year-old. Your ALT here would be up to 35. But again, NCLEX will not give you an ALT level of 36, 37, or 40, because ALT level of even 40, for example, is not alarming. Okay, it is not a medical emergency. So NCLEX will actually give you up to the roof of 100 for you to be able to escalate it to the doctors. So anything above 50 is no good liver function. Okay, so that's how you memorize it. Anything above 50, that's a time that the body actually deteriorates, and that's a time that the liver will actually not have a good liver function. So because NCLEX will not give you an ALT or AST that is low, because we're talking about liver function tests, they always give you something that is high. And so your ALT and your AST, whichever is given in NCLEX, or it can be interchanged as SGPT, SGOT as well, it should be more than 50 to be able to say that it is abnormal. Okay, so they come together, and think about 50 for both of them. And then you need to remember your acid-base balance concepts. Do you remember that? If you don't know these normal values of acid-base balance concepts, I will encourage you to go to the YouTube page if you're not a student. If you're a student, a more detailed explanation is in your learner's portal. If you're not a current student but would like to learn more about acid-base balance, it is in the YouTube in our YouTube account, and it's titled Demo Class Acid-Base Balance. And we need to know these values as well. So Vishwa was telling about blood pH level of 7.35 to 7.45. Take out the 7, that is your carbon dioxide. Pressure of carbon dioxide, which is 35 to 45. And then you have your 22 to 28. Some books would say 22 to 26, but then again, NCLEX will not ask you this, very close numbers. It will either give you a 30 of bicarbonate, or it will give you 16, for example. Okay, for acid-base balance, it is something that you have to memorize, but the concepts on acid-base balance, what will happen if the body has a lot of carbon dioxide, what will happen if the body has a lot of bicarbonates, is very important for you. And I would encourage you to visit the demo class that we have for acid-base balance, or to our existing students, you have a more detailed explanation and some activities in the learner's portal. All right, so that's just an example of how you remember things. So I want to ask the group just a very quick evaluation, and anyone can answer. You can give this as a chat. What is your normal CRP level? You can talk, you don't have to chat.
Only 10.
Sorry, Vishwa, you were saying something?
10.
10.
10.
Or less than 10. Why? It's crap. It's very less. It should be less than 10, and that's why it's less than 10. Very good. What about your BUN? What's your normal BUN?
10 to
10
20.
to 20.
Very good, because my family, we're a family of 10. We have 2 buns, and so we have altogether 20. What's your normal calcium level?
2 millimole to 2.5.
Sorry,
To
Sandesha,
2.5.
I can't hear you properly. 2 to
It's 8 to
2.5.
Yeah.
Somebody was trying to talk as well. Sorry, I could not hear that properly. Okay, 2 to 2.5. Why? Because milk in Australia costs $2 when you buy them. Yes. What time do you normally take your milk?
9 to 10.
9 to 10.
9
So
to
if
10.
perfect. So if NCLEX gives you another value, 9 to 10, you will remember, because that's the time you take your milk, which is high in calcium level. Is an ALT of 120 normal or abnormal?
Abnormal.
Abnormal. Why?
Because the ALT level is always less than 50. It's up to
Perfect.
35 to 50.
Yes, because
If it is more than
yes, Sandesha, keep going. I love that.
if it is more than 50, then we have to consult for the healthcare professional for further inquiries.
Perfect. There are times when the ALT level is 40, which is above the normal 35, but that is something that is not life-threatening. Okay. So anything above 50 is something that you can consult to the healthcare professional or to your supervisor, whatever is given in NCLEX question. But definitely the liver is good up to 50 years old. Okay, when you talk about liver function test, it is always, you're always looking into the higher amount, because the higher the amount, the more damaged the liver is. Okay, and we're looking into the function of the liver. Perfect. And acid-base balance is your assignment. You need to go to your learners portal or to the demo class.
YouTube.
All right. So NCLEX also will not only ask you about the values, right? NCLEX will also ask you how to collect the specimen, in what manner. Urinalysis, for example, is through a midstream urine. Your ALT, AST, for example, is through a blood test. Your blood glucose level, for you to be able to get the most accurate, should be a fasting blood, isn't it? Or your HbA1c can be taken at any point, at any time. Yeah, so NCLEX will ask you not just the value, but also how to collect and when is the best time to collect this specimen. So you need to be familiar with that. It will also ask you, what does this report means? And when you say about what does this report means, it will actually ask you, what is your intervention as a registered nurse? Are you going to escalate this? And when you look at a laboratory result, the only thing that you need to do is whether you have to do something or not to do something. Okay, so it's very easy. You've got only two choices. But what is really important is you know what to do if something is wrong. And of course, your patient teaching. So say, for example, if your patient has high potassium, then your patient should be on a low potassium diet. Or if your patient is high in calcium, then your patient should be on a low calcium diet, okay? So you need to know the patient teachings when it comes to the results of the laboratory values. And this is something that I know, you already know, or if you don't know, you can recall by looking into these laboratory values and studying the background of it. So for the purpose of this demo class, let's have a go. All right, I have put here for both NCLEX and OSCE, and I would love everyone to participate. So when you go into our NCLEX classes, we actually also put an icon to our questions. And this is in our Wednesday classes, because we want you to self-evaluate, assess yourself, whether or not, where are you strong at, and in which area of the client need do you need to improve on. And if you go back to our learners portal, say for example, this icon in Neta means that this is safe and effective care environment. So if you are weak at this area, when you go to your learners portal, you will actually see your mock test and your readiness test have questions about safety and infection control, everything that falls under safe and effective care environment. And you can practice that. Okay, and you can see here that these questions actually fall on different client needs as well. So your laboratory value, as much as I would say this 15% that will come out as a laboratory value, it's not like that. Not like your pharmacology where there is like 15% or 13 to 18% that will come out. In your laboratory values, in your NCLEX, in any client need, it will just come out. Okay, so let's take a look. The nurse reviews the most current laboratory data for 4 clients to whom the nurse is assigned. The nurse should first assess the client in which laboratory value. What is our answer?
Number.
3.
So Maria said C, or number 3. Bharat said number 3. Who else? Everybody said number 3, right? Yes? Perfect.
Yes.
It's number 3. Why?
Because platelet count is very low.
Okay. Looking into this, if you have very strong knowledge about your laboratory values, you can just say a platelet, oh my God, that's very low. It's between 150 to 450. And that's because of your experience. You have a visual memory that back home, where we are from, and I would say majority of our participants are from the Philippines, India, and Nepal, where dengue fever is very common, where platelets is really affected, and we can see it's 150 to 450. Then you can see that based on your experience, related in your experience, and you can see it's number 3. If you'd like to use the process of elimination, then you can say that potassium level 5 is normal,
Normal.
isn't it?
Yes.
Yes, hemoglobin of 118 millimoles is
Normal.
slightly below.
No.
It's normal or slightly below normal, but not a medical emergency. Hemoglobin will only be a medical emergency if the patient is symptomatic. Okay, the patient experiences pallor, the patient experiences dyspnea, the patient experiences confusion, and that's the time it becomes a medical that needs medical attention. Otherwise, this patient can go on iron supplement, and that is in the initiative of Australia for blood management, which you will find out as well in probably another demo class or when you join OSCE with us. Number 3, definitely something that is not normal. White blood cells of 5,000 is also normal. Therefore, your answer here is number 3. Oops, that's a laser pointer. I need a pen. So your answer here is number 3. The nurse is caring for a client who is retaining carbon dioxide due to respiratory disease. The nurse anticipates that as the client's CO2 level rises, the pH will most likely be of which value. So we're talking about high CO2. And what did we say in our acid-base balance class or the demo class?
First answer.
Sorry, Bharat, what's your answer?
First number, ma'am.
Number 1. Anybody else who's got a different answer? Okay, we always consider carbon dioxide as a representation of an acid. So the more carbon dioxide, the more acidic the blood becomes. Okay, so in this case, which one tells us of an acidic blood? Anybody?
7.30.
So anything that is below 7.35 is acidic,
Acidic.
and anything more than 7.45 is basic.
Yes.
Basic.
So logic will tell us that high CO2 is acidic, so it should be less than 7.35. Bharat, you are right. It's 7.30. Very good. The nurse is assisting a client on a low potassium diet to select food items from the menu. Which food item, lowest in potassium and selected by the client, indicates an understanding of this dietary restriction? So actually, if you look into our NCLEX classes, we identify which one is the stem, which one is, what are your keywords here, what is NCLEX trying to ask you, how do you eliminate questions? But for the purpose of this demo class for laboratory values, I will leave that for a next demo class on question strategies. So spinach is high in potassium, and this is your very solid nursing knowledge, and that's the reason why you need to also know about diets. And in your must knows, by the way, if you enroll with us, you also have here examples of diets. So common therapeutic diets, low residue diet, high roughage, high fiber diet, and there are also sample meal item in here. Okay, so that is a 2-page of your must knows, and also on the next page you can see here the type of disease and also the type of diet that you will give to your patient. So that is in your must knows. Therefore, spinach. What else? What is your answer here? So your spinach. Maybe what?
Maybe 3, ma'am.
Maybe 3. And that maybe is your first hunch, Bharat. And this is what I mean. When you have your first hunch in NCLEX, if you're not sure, and that's your first hunch, make it as your answer. If you're not sure, after analysis and you're still not sure, go to your first hunch. Most probably that's the right answer. Lima beans, or we call buttered beans, is actually high in protein, low in potassium. The rest of these, if you can see, has high water content. That also means high potassium content. Okay, so you can see most of your high water content actually has high potassium content as well. This is an example of an OSCE question. So Mr. Peter Patterson, it's like a tongue twister, 55-year-old male, is admitted to your ward for the treatment of burns. He has a background history of acute renal failure and hypertension. All vital signs are normal. Remember the grading of burns? That grading of that burns is 18%. Mr. Patterson requires IV fluids as per order below. Demonstrate what will you do to your patient as a registered nurse. I'll give you 1 minute to think and tell me what are you going to do. We have an answer here. Use the Parkland formula. Good. Any other thoughts? Would love to hear other thoughts as well. All right. What are you going to do with your patient? Let's break this problem and we have to analyze, because this can come out. And this is an example of a critical thinking. If you would look into this problem, just looking at it without critically thinking, OSCE would like me to administer an IV fluid. So this must be a skill on IV hydration, and OSCE probably would want me to prime these IV fluids. But before we do that, we have to think critically whether or not this IV fluid is actually safe for our patient. Because remember, OSCE is trying to check whether or not once APRA gives us the registration, we are not going to kill a patient. Okay, so APRA wants to make sure that if you're the one looking after this patient with burns, are you going to give these IV fluids? So your patient is 55 years old, admitted for burns, who's got 18% of burns. What happens to the body when there is burns?
Loses the skin integrity.
Skin integrity, yes. We're looking into the safety. So skin integrity probably would be a long-term goal to solve. EJ just said there is a fluid shift. Perfect, very good. And therefore, if there's a fluid shift, what will happen? What happens when there's a fluid shift?
Potassium level?
That's what I'm looking for. I'm looking for that word, potassium. All right.
Oh, okay.
I'm looking for that level. I'm sorry, I'm looking for that word, potassium. But when it comes to fluid shift, does your patient get dehydrated with burns? Yes or no? Yes. Do we need this patient to have IV fluids? Yes. So is this perfect? So is this patient then indicated, or is there an indication for IV hydration? Definitely, this patient needs IV fluids. So this order must be right. So let's review the order of the doctor. Today, the doctor has ordered some fluid for resuscitation of this patient of 1.9% of normal saline, 1 liter with 10 mEqs of KCl. Somebody said about potassium. Very good critical thinking. When your patient has burns, in the cell, potassium is the most numbered. They're the winner of intracellular ions. So there are so many of them. But when there is a destruction of these tissues, potassium needs to go somewhere. They don't evaporate in the air, don't they? They stay in the body. But where do they go? They go back to where? They go back to the blood.
Blood.
Isn't it? Yes. So they go back to the intravascular system, and with high potassium level in the blood, that's potassium by the way, with high potassium level in the blood, do you want to give 10 mEq of KCl at 100 mL per hour? Definitely not a smart idea. We're gonna let our patient go to arrhythmia, or eventually your patient's gonna die. Therefore, this is something that OSCE is trying to tell us to be safe. So this is actually not a skill of IV hydration then. This is a skill of escalation. You need to escalate this to the doctor. You don't wanna give this. So this is actually an ISBAR scenario. Okay, so again, if you're not familiar with ISBAR, you don't know what is ISBAR, probably this will be, there is a demo class, by the way, of ISBAR if you'd like to, that was conducted by Charlene. That was very informative. It's in the YouTube account as well. So go through that ISBAR, but this is actually an ISBAR skill and not an IV hydration skill. So therefore, you are going to perform ISBAR, which is again another demo class, because this is ISBAR is again another 2 hours of session. All right, so with your NCLEX and OSCE, if you enroll with NETA, you get everything in your learner's portal, but also you can get some books. We actually have some books that you can borrow, and these are hard copies of the books. And these are all the books recommended by APRA. The good thing is we have integrated all the contents of this book to the program of your OSCE. So whether it is through your learner's portal or your workbook or your face-to-face or online classes, we have integrated all of this into your program. Student support, by the way, this is Faith, our nurse educator, and our very lovely student support as well. So you can see her face when you talk to her on the phone. This is her. Karen, who is with us today. This is Karen, and that's me. And you know what? You always talk to Roji, right? Because Roji, every time you call, hello, Roji speaking. This is Roji with a very smiling face. So that is her, and she's very friendly. So if you'd like to know more about our NCLEX and also our OSCE classes, we do have a separate video of this in our YouTube account. So please feel free to visit. What is important there is we have put this as a blended learning to suit everybody's needs, and you take control of your own learning. You can also visit our website and go to the team so you can see our educators and our different specialties, because we value teamwork here. So we are not the superheroes of every nursing field, and that's the reason why we value our nurses and our educators. So let's connect. You can contact us. At the moment, the Sydney and the Melbourne offices are closed because of the lockdown, and I hope people will do the right thing so that we can continue to operate, and we can also continue to help you process the registration faster. So let's do the right thing for everybody here listening today. Wash your hands, social distance, wear your mask, and stay at home if you don't have to. I feel like I'm Gladys, who's doing this press conference every 11 o'clock. Yeah, so, but we are still open in the regional office where I'm here at the moment. So if you are in the regional, feel free, not if you're from Orange, because you're also in lockdown. So otherwise, the best way to contact us is through email, which is info@nursingeta.com. Give us a call through those numbers. Bharat, and to all others who are overseas, We are very reachable in our social media pages, so feel free to message us in Messenger. And of course, guys, there are so much information in our YouTube page. We understand that those who are overseas at the moment, who can't come to Australia as of yet, if you would like to learn more information about certain topics, please feel free to visit the YouTube page, and you can make comments there of whatever topics that you want us to discuss in the next info session. All the best, everyone. I think this is it. Thank you very much for listening. Let's do a time check. At 12:15, probably we'll just listen to maybe 2 or 3 learnings for today, and anyone can just pop out. One learning, maybe I'll just call out. Vishwa, you're about to say something.
It was good, informative, and it was like very easy to remember the normal values. And rest of the normal values, I will make myself stories and I will remember that one. Thank you for that.
Thank you very much, Vishwa. And that's exactly the purpose of the demo class, for you to be able to make a story of your own, because you are the one who would know your own story, and for you to be able to remember. And that's the easiest way to remember if you are not a visual learner. If you're a visual learner, all means do your index card or your flashcard and put that thing in your wall, so that will be your best friend, before and after you sleep. Somebody's trying to do an annotation on my screen, but it's okay. Yes, anybody else would like to share?
Yeah, I have learned, ma'am, like everything need to be write down on a paper and placed it in front of us so that we can remember always while seeing that.
Good. That is a good idea. And, different person learns in different ways. So definitely putting that on top of your bed so that, before you sleep, thank you, God, for a very good day. Potassium, sodium, calcium, phosphorus, that's what I'm going to memorize. And when you wake up in the morning, thank you, God, for such a beautiful day. Then you have your ALT, AST, and lipase, for example. Just an example. Good. And we have, I will not forget now, the value for BUN, urine pH, and calcium and potassium because of your stories. Thank you. That's good. Sandesha, one learning for today.
Yes, ma'am. I have learned how to visualize the daily things and to correlate with the learning.
Good.
Like that, it's very easy to remember.
Very good. And I like how you say it's very easy to remember now. So hopefully your assumption, your perception about there's too many normal values or it's very confusing has a solution at this point. Thank you. Kavita, do you want to share? I think Kavita just joined in. Is that correct?
Yes, I just joined in.
Right. Kavita, this information session is recorded. Feel free to revisit this in the YouTube page because we will be posting this in the next 2 to 3 days. All right, guys, I really value your time. Thank you very much for listening, and we will see you again in the next info session.
Thank you.
Bye, everyone.
Thank you.
Okay, thank you, ma'am.
Bye. Keep safe in India, Bharat.
Thank you, ma'am.